This morning, we're going to have a panel discussion on healthcare, in which I will ask our physicians and the Dean of the Nursing School questions, and then have some comments and insights from His Holiness. But first, allow me to introduce the members of our panel. Seated to my left is Dr. Dick Garant. He is the founding director of the University of Virginia Center for Global Health, a recipient of the Walter Reed Medal and the Thomas Jefferson Award, and a member of the Institute of Medicine of the National Academy of Sciences. Next to him is Dr. Leslie Blackhall. Leslie is an associate professor of internal medicine at the University of Virginia and director of the Palliative Care Center. She is also an associate professor in South Asian Studies and Tibetan Studies. Seated to His Holiness' left is Dr. Jim Nataro, the pediatrician-in-chief at the University of Virginia's Children's Hospital. Dr. Nataro is a voice for children's health, not just at the university, but for children throughout our community. Next to him is Dean Dory Fontaine. She is a dean and professor at the University of Virginia Nursing School. She is a strong advocate for interprofessional education and has started a compassionate care and empathic leadership initiative at the university. And finally, Your Holiness, this is Dr. George Beller. Dr. Beller is professor of cardiology at the University of Virginia. He was chairman of cardiology for 28 years and started the first cardiac rehabilitation program in Virginia. And of course, joining us today, making this a very special day, is the spiritual leader of Tibet, the recipient of the Nobel Peace Prize, His Holiness the 14th Dalai Lama. So I would like to begin today by asking a question of Dr. Nataro. Jim, could you offer a brief definition of what we mean by mindfulness? And then could you talk about why it's important that we encourage mindfulness in our children in a society that works against it?
Thank you. I would like to personally express my appreciation first for the visit of Your Holiness and for the very positive messages that you bring us. Buddhism encourages us to be aware of our behavior and its sources, to be present in the moment, and to control our cravings and desires. It teaches us that these practices can bring true happiness. The Mindfulness Center here at UVA uses the term mindfulness to encompass this beautiful philosophy and defines the term as non-judgmental, present moment awareness. However, it is difficult to practice this philosophy in our Western society, which seems to embrace its very opposite. All our time must be killed, all our needs must be filled. As a pediatrician, I am particularly concerned that our children will grow up in a world without silence, without peace. I am concerned that our generation of adults is insufficiently prepared to teach or model an alternative. How should we begin with ourselves and our children to bring a little more peace and awareness to our lives?
So you're asking His Holiness the question?
Yes.
Yeah.
medical Respected brothers, sisters, and audience brothers, sisters. Indeed, I'm very happy and great honor. At the same time, I think real topic about medical care.
No.
So I'm not a physician. I do not know any medical things. Only thing, take medicine. Then I think I want to mention to you something. Many years ago, one time in England, Albert
Albert Hall,
Hall. You see that?
Royal Albert Hall. Yeah.
Royal
Albert Hall.
This is my some lecture talk. Then at the beginning I mentioned among the audience some may have sort of the feeling of curiosity and simply, you see, came to listen to my talk. That's okay, no problem. And then some people may have sort of feeling or view Dalai Lama have miracle power. That's nonsense. Then some people may feel Dalai Lama have healing power. Then I told, so that is totally also a mistake. Firstly, I myself very, very skeptical about this so-called healing power. And if there are really sort of a person who has a real sort of healing power, then I would like to call that person and show it's my skin disease. Then next day, I received some ointment for this. That's a real blessing. That's a real healer. So that means medicine is very, very essential, very important. Perhaps I may add something. I think we all have the same experience when we sort of medical checkup or some treatment in hospital. The doctors and nurses who are taking care of you, showing more human feeling, genuine love, or sort of genuine sense of concern for the patient's sort of health. Then you feel more confidence, or they're really taking care of me. Sometimes some doctors, nurses, without smile, and carrying their work almost like their duty, and treat it like you as a mission. Then sometimes you feel a little anxiety.
Anxious.
Such people, you see, even may carry some experiment on my body, like that kind of feeling sometimes happen. So therefore, the medical sort of treatment itself, of course, very important, qualified one, experts, very important. But meantime, we are living sort of sentient being. We have the feeling. We very much appreciate human affection. So is it the medical treatment with affectionate sort of attitude, affectionate feeling or motivation, then that medical treatment becomes more effective. That I believe. Sometimes in Tibet, this is my friend, when I was very young, they say, oh, such doctor, physician, their knowledge is concerned, expert, but their medicine not very effective because their heart not very good.
Not very compassionate. No?
Not very compassionate. Then such a doctor, their sort of knowledge or qualification may not be so high, but a very warm-hearted sort of person. So therefore, their medicine much more effective. So that also shows the professional sort of knowledge and sincere motivation, compassionate motivation, combined together. I think they did because of the Giti. The Sataji, you see, you mentioned that although you trained, but after you met that native girl,
The girl.
so I think that's very important. So and I think with that kind of sort of motivation, that kind of sort of expression, not only they receive some positive sort of feeling towards patient, but doctor himself or herself, then your work really give you some kind of now
Meaning.
I'm feeling in my life
Purpose.
some purpose. Only salary or some other things, then sometimes you may feel tired, a little frustration. If you have some real willingness to serve, to help the patient, the visitor hospital, only those people, no one go to hospital for
fun.
For
fun.
For picnic, no, never. There are only something wrong. So with the hope to remove that problem. So come. So they really help, medical help. Therefore understand, realize that, and then totally to dedicate, serving them. So protect them everywhere. Then, I think you mentioned Buddhism philosophy.
No.
I think any major religious tradition is always talk about, love, affection, forgiveness, tolerance. These always religious tradition carry same message, same practice. So actually, the profession, in medical profession, that's actually the act of compassion. So really wonderful. And then particular question.
저들이 부조리야 아니 쌤그 시대 용어다. 디 때때스 저 temperament 도야게. 타올 가려놨어. 다대도 줄 부조 남행시 지금 올쪽 열었어.
I think your now question. Perhaps I think you know better than me. I have not much experience in dealing with children or young people. I don't know. But my belief, fundamental belief is, there is not much differences, Easterner or Westerner. Same human being, same sort of ability, same potential. The way of life, environment differences, but influence from environment, you see, very effective, but still limited or there's limitation. If the person himself or herself, you see, certain sort of, an experience or certain knowledge, then external environment may not, because of that,
influence that much.
That much. So, certainly, for physical health, very much related with mental health. Healthy mind, that means calm mind. and with sort of optimistic sort of attitude, positive attitude. That's very helpful for prevent illness, and also even if there's some sort of illness already there, I think recover much faster. So I think medical system more holistic, not only taking care of body, but also taking care about emotion. That I think important, I feel. So it is true. This is the teach, right?
Teaching.
Or make known from young age the mind something very, very
Important role.
Influential or important role. I think modern society, not only here, Europe or West, but also now Asia, the material development, to the people, I think from a young age, the people get sort of impression, material value is top most important. And with that, money or these things top most important. So sometimes it's a neglect about our inner, real
Resources.
Resources or ability. So that's why I strongly sort of feel, not myself, some of my, as a result of discussion with some scientists, some educationists, some social worker, through several years, then eventually it becomes clear the existing modern education system lacking about the inner
qualities, values,
inner values. So sometimes I feel, say 1,000 years ago, in European continent, separate education institutions started. The one thing I remember very clearly, the Bologna University in Italy. One time, I visited there, they invited me there on their 1000th anniversary. So I remember that institution, education institution, set up 1,000 years ago. So therefore, at that time, moral principle or inner value is concerned, according to Christianity, this inner sort of value is concerned, that the church take full care. And then newly established separate education institution, then taking care about the brain knowledge. Quite, I think, well balanced. Now time passes, the influence of church, not that much effective. So then, according to that reality, the education institution itself now should carry, should have both the responsibility to give awareness or education here, and taking care or education about importance of warm-heartedness. So I'm very glad, you mentioned something importance of this meditation or training, mindfulness like that. And about the training of mind, mindfulness,
Yes. His Holiness wants to make it clear that when we think about mindfulness, the credit should not go just to Buddhism alone, in far as the development of mindfulness is concerned.
And ancient Indian sort of tradition, both Buddhist tradition, non-Buddhist tradition, they very much sort of the emphasis, importance of training of mind and samatha or shamatha. It's common, Buddhism and non-Buddhism. And I was told the ancient Christianity, also have some sort of practice of shamatha. I was told in Greek Orthodox, some island in Greece, some monastery in mountain, they still carry. I haven't sort of opportunity to research, but I heard they still carry some sort of session of meditation like that. So this is something common for all major religious tradition. And then Buddhism, maybe modern time, more because of the fashion plus to ka.
Yeah, it's at the moment fashionable.
Now next.
So, Your Holiness, you mentioned compassion as an important virtue in a healthcare provider, and the dean of our nursing school, Dory Fontaine, has started an initiative, a compassionate care initiative. I would ask her to tell us a bit about this initiative, and then maybe you can comment on what we're doing at the university.
Thank you, David, and welcome, Your
Nursing
Holiness, and
ki-
our wonderful audience. I am very pleased to briefly share with you the value of our Compassionate Care and Empathic Leadership Initiative. It is all about paying attention and pausing. Our vision and goal is to reduce human suffering by cultivating compassionate people and compassionate systems in healthcare and health. So this initiative is part of the reason I believe that Sonia and Paul Tudor Jones chose to work with us to create the University of Virginia's Contemplative Sciences Center. Here's what we're doing. We're paying attention to ourselves, being mindful, creating space so we can open our hearts, so we can better care for our patients, their families, and our communities. And we're focusing on this in two very special ways that I want to share. First, we're inviting all of our students, nursing, medical students, to consider how paying attention can help them to notice their responses and reactions, developing a reflective practice so that they can be more present to others, cultivating qualities of compassion and creating what we are calling resilient practitioners. Secondly, we are offering our healthcare providers, our physicians, nurses, chaplains, social workers, and many others, patient care assistants, at the UVA health system and here in Charlottesville, another way to pay attention and reclaim the soul of healthcare, reclaim their own soul, and remember the reasons that they first went into the healing professions, because many of our healthcare providers have a broken heart today. So we're educating our students in mindfulness. We're actually training them to cultivate mindful practices of inviting stillness, inquiry, and deep reflection. We're training all undergraduate nursing students in the basics of mindfulness and stress reduction, and our medical students are involved as well. And in the medical center, we're introducing mindfulness concepts, as David mentioned, to our healthcare practitioners through the Mindfulness Center in John Shoreling and through our Compassionate Care and Empathic Leadership Initiative. Nearly 50 individuals have attended Roshi Joan Halifax's Being with Dying program. We've sent 50 of our individuals here, and I know you know Roshi Joan very well. That's at UPI in Santa Fe. We've been doing this for the last 3 years, funded initially by Mrs. Tussie Kluge, and now the School of Nursing is funding our colleagues. We're asking them to learn how to compassionately care for the dying, because when you do that well for the dying, you're really caring for the living and all of us. So in the School of Nursing, we're also asking our students to develop and cultivate compassion through very practical ways, keeping journals, doing reflective writing. We're teaching listening skills. We have a course now called Difficult Conversations, who my colleague Dr. Leslie Blackhall and Jeannie Erickson are teaching together, nursing and medical students together. So let me tell you a very quick story about a practical way that we are explicitly doing this at the University of Virginia. This is a story from Jonathan Bartels, who's a wonderful emergency room nurse here. I hope you never need our emergency room. but if you do, you need to ask for Jonathan Bartels. He said that he noted that when people die after a traumatic instance, a code, a tough situation, doctors and nurses are discouraged and frustrated and kind of throw their gloves down and then leave the room and have to go right on to the next patient because the ER is very crowded. And so what Jonathan decided to do was create the pause. It's 45 seconds. Everyone just stops. Doctors, nurses, the chaplain, they stop for 45 seconds and honor that patient who just died. Could be a child, could be someone in an accident. They've even invited patients' families to do this, and they honor the good work that each of them did as well. So it's catching on, because recently up on one of the medical floors, an anesthesiologist had a tough code, tough situation, and the patient didn't make it. And he said, can we all stop and do the pause like they do in the emergency department? It's pretty amazing. It's pretty amazing. So it seems simple, powerful result, being present, paying attention. This is how I hope we can change the culture here in Charlottesville, at the University of Virginia, create resilient nurses, the next generation of our students, and have people pay attention so that they can better care for others. So I would stop there, but I would love to hear what Your Holiness might think of our Compassionate Care Initiative.
So you already, I think, gained a lot of experience from actual sort of work. So wonderful. I just felt under because we get zadar 중사를 실려 즉 second 카시아로 즉
나래.
직sem 직도와
나래.
난주 남기 들어가다 now I want to use some Tibetan. 맞으디 but 남도 즉 차단으로 숙성부지에이나 되네 헛칼이지 개별로 교야성인데 더 강해 체요. 되네 이미 디자인에 로로 구조사야성인데. 지식인 판단을 sometimes. 직신 samlole ko semti yaya so she and physically udik pandamet sometimes.
So one specific point, that example you gave was the 45-second pause, especially by the emergency doctors after a very difficult case when they feel frustrated, and how it has affected. So His Holiness was saying that this is a very, very good idea, and it resonates something that is in the Buddhist tradition, where there is an understanding that when you try to turn your, kind of thoughts from a very disturbed...
when sort of, what's the mind too much sort of involve attachment or anger or some of these negative things, then immediate shift to another positive sort of, what's the
state of mind.
State of mind, difficult. So usually we do one sort of technique, like you see, even on chair, no problem, but you see, body straight, and then like this, deep sort of breathing way. Then like this. Three times. Then this. Then usually we do another sort of 3 times. That's both the nostrils. During that sort of practice, your mind fully concentrate.
Focus now.
The focus
on the breathing.
Breathing. So that after, say, it takes 1 minute or 2 minutes, then your mind then become
Settled down.
more settled,
Settled.
more calm. So another sort of, I think the advantage is your breathing like that. That also physically also some sort of
Effect lang.
effect that I felt. You carry some experiment.
Maybe.
If you find this is some value, then carry more. If you find not much, then forget.
We shall try it.
That's all.
大家紧张。
Thank you.
Your Holiness, as we talk about death and dying, Dr. Leslie Blackhall, the issues for her whole career have involved end-of-life issues. And I would like, I know Leslie can talk for a long time about this. She has a lot of thoughts on what are the problems in today's medical system involving end-of-life. And maybe then you can also help us with that.
End of life, palliative. Now.
Your Holiness, we're all honored to be here with you. I often have heard you speak about the preciousness of human life, and I think all of us who work with seriously ill patients are made aware of that every day. Medical science has made many advances since the early 20th century, curing diseases like tuberculosis and other infectious illnesses that used to be the leading causes of death. And people with diabetes, heart disease, and cancer now live longer and healthier lives. However, all of us must eventually die. And even if a cure is found for illnesses like cancer, none of us will live forever. Our healthcare system, however, does not seem to often acknowledge this fact, and that leaves patients, their families, nurses, and doctors struggling to take care of patients who are at the end of life. Medical systems, hospitals, clinics are really set up to value productivity, efficiency, and fixing problems, often with technology. But most people in the developed world now die of chronic, progressive, life-limiting illnesses like end-stage heart and lung disease, incurable cancer, and dementia. And these are illnesses that can't be cured even with the best of medical care. Early on, many interventions, surgery, chemotherapy, artificial life support, can prolong life and improve the quality of life. But as these diseases progress, these interventions are less and less beneficial. Nevertheless, because we are in a system that values efficiency and technological fixes, many people, there's often not the space to consider how should we care for people who can no longer be cured, to spend the time to talk to them. And in the end, many people end up getting interventions that are very aggressive and invasive, despite the fact that they were unlikely to benefit and may actually harm them. There was a recent study done that looked at the use of surgery towards the end of life for people with Medicare, meaning over the age of 65. And that study was really shocking to many people when it came out because it found that 10% of people who receive Medicare get surgery in the last week of their lives. And one of the authors of that study, who himself was a surgeon, said in an interview he remembered how he had done surgery on a patient with incurable pancreas cancer who was having a complication of that cancer, which was to be expected. Even though he knew he couldn't fix it, he did this surgery, and as a result, the patient spent his last days on an artificial breathing machine. And looking back on it, he realized that it was easier for him to do the surgery than it was to talk to the patient and his family about why the surgery wouldn't work. And as a result, even though most people say they'd prefer to die at home surrounded by their family, increasingly they die in intensive care units connected to machines, unable to interact with those they love. Dory was mentioning the Compassionate Care Initiative, and one of the main goals of that initiative is to help make the care of people with terminal illnesses more compassionate, more mindful, and more appropriate to the stage they find them in. That includes the project where we're teaching medical students and nursing students to work together to help people with those types of illnesses, changing the medical curriculum so it includes the idea that end of life is part of the continuum of care of all patients, and a project we have that we just got a grant for to help people with advanced cancer by integrating supportive and palliative care throughout their care. Nevertheless, this is a difficult issue for all of us. And my question for you, Your Holiness, is how should the fact of human mortality affect how we practice as physicians, nurses, and how should it affect the way we live our lives, all of us?
간다 지원다니 뭔지 그 돈에 메시게다야 교르게다야 시카르베나 간다 누조그 디조 맹그 다당 돈 제베나 내 정말 쭉 거에 장장 sam당샤마도 치워 뭔지 지금 소리 듣는 도스 디잖아 가는 거지 되고
Yes, it is true. I do not know the particular sort of field, particular point, right? But generally, I believe the person's sort of mental attitude, sooner or later, death will come. It's part of our life.
part of our existence, part of our existence,
Part of our
existence.
existence. So, familiarize, so understand about that nature, and then actual death come. You see, you already sort of acknowledge that. Perhaps at that moment, maybe emotionally less disturbance. Other hand is those people who never thought about death. Of course, everybody have this
We all have kind of some form of grasping to permanence.
So with that, you see, never is a thought about death. And also sometimes people, even the word cancer or death, this very word, they frighten.
They're disturbing.
Disturbing. So such people, when actual death come, I think terrible. Their mind never prepared for that. So that I think, you see, this is some help. My own, as a practitioner, at a daily basis, always remember impermanence, and actually, sort of also they meditate on the nature of impermanence, the grosser level of impermanence and the subtle level of impermanence, momentarily changing, is, but still not yet tested. Actual death not yet come. So there is my daily practice, how much sort of help at the actual my death. You see, not yet come. So I don't know. I cannot say 100%, but I guess, you see, because the thinking already sort of acknowledged, accept sooner or later that will come. I think maybe a little different. And then also, then the philosophical field, or philosophical, or I don't know, the concept life after life, or concept after this life, heaven, or hell. So even those people who eventually used to go to hell, but at least some period rest in coffin. So therefore, you see, the death is a real sort of end. These are thinking, also some sort of effect. Some make some differences. The patient. Maybe some cases even sort of more disturbances. Thinking more sort of negative side. Like the Buddhist, also you see the thinking is the next sort of the difficult sort of rebirth, difficult sort of rebirth in difficult sort of realms. Sometimes that frightened, frightening. More may raise anxiety. So then those people who never thought about the next life, then maybe simpler. But at the same time, you see some people, you see, that the real end. So maybe to some people, just that is nothing, the real end, maybe more uncomfortable. Then the concept life after life may cause of the help. But some other people, maybe it's death, just death, nothing. That may also use a help. So among humanity, I think the dying person, I think we have to sort of judge their basic sort of mental attitude and belief, and then accordingly treat better. Those people, you see, who have some sort of interest about life after life, then I think give them, oh yes, now you are old body, now already becoming some useless, so therefore looking forward, new body, young, fresh body. That does not mean, you see, those like myself, you see, the age now above, my own case is 77, and then some people, you see, the 80s or 90s, now better to go sooner the better. I'm not saying that. You see, some old people, some difficulties, eyesight difficulties, hearing difficulties, like myself, you see, this was knees also some difficulties, then may feel, now better to take new body. That I think, I'm not saying that. Still, you see, better. Even you see those, in a way, I think, because of the incomplete sort of human body, where already some damage. When I usually decide they remove the gallbladder, the surgeon, wonderful person, one Indian, quite well known. So he told me, he expressed to me, God creates this body. So all these organs, certainly you see, created by God. So you see, God also, you see, created a certain limitation of these organs. So now that gallbladder organ now already reached the end, no longer any use. So now better to remove. He mentioned that. So that also, you see, I think from the theistic viewpoint, it is true. So in any way, I think that here, one thing I'm quite sure, we also trained, the mental attitude, even something very negative, conventionally, commonly, because of mental attitude, sometimes can see very positive. And on the other hand, it is something actually very good. But the person, individual, his or her sort of mental attitude is such that something very awful. Clear?
No.
So physical level, pains are truly pain. Even animal recognize that. But the mental sort of worry or mental pain must depend on our own mental attitude. So therefore, I think the dying person at that moment is to give some sort of hope and give some sort of
Peace. No.
because of that. I think you see, if the dying person, you see, carried his or her life more because of the positive way, then reflect on these things, then my life, you see, because I carry my life meaningful, at least no harming other people. So thinking this line, then feel happy. Now and come, I'm satisfied. So at the last moment of our life, peace of mind is very important. So because of that, according to common sense also, you see, the peaceful, right? Death,
Peaceful death, no?
right? Peaceful death, good. And at least his or her sort of the family member feel, because of that, less what say,
Sad.
less sad. If the dying person too much sort of agitation and cry and that anxiety, then the family members, I think, rest of their life, may remember that occasion. Right? Some of their dear person, now at the time of death, too much cry, too much
sadness. No?
Sadness. So therefore, that peaceful way, is very important. Then, according to those who also the tradition, life after life. Even now, for example, Buddhist tradition, according to Buddhism and also Jainism and some other, at the moment of dying, at that moment and about that moment, you see, very important to the mental attitude.
The state of mind. State of mind.
State of mind. If state of mind at that moment positive, then the next life almost is sure good life. Although you see that person during lifetime,
During the life.
During the life, it's just some negative things is done, but at the last moment, experience some positive mind, mental state, then that effect next life some good thing. Person who has a lot of good
deeds, no?
Good deeds, but the last moment some negative anger, something like negative thing, then next life almost certain some negative. So at the time of last moment, peaceful mind is very essential.
Thank you. One of the things we've talked about today has been the relationship between a doctor and the patient. And Dr. George Beller has written about that relationship and how it's changed over time in this country. And so, Dr. Beller, maybe you could talk a little bit about that.
First of all, Your Holiness, we're truly honored by your presence with us today. David, I would first like to state that compassionate, patient-centered care is fundamental to the practice of medicine and is the essential element of an effective doctor-patient relationship. It is, in fact, this desire to care for others that led many of us to become physicians in the first place. The goals of compassionate care include treating patients, as you said, holistically, considering the biological, psychological, behavioral, and social aspects of their health, providing emotional support to patients and their families, recognizing distress and relieving suffering, listening deeply to patients' concerns, and seeking to understand their perspective, communicating information to patients clearly and honestly, and encouraging patients to play an active role in the decision-making regarding their care. When healthcare providers offer empathic communication and emotional support to their patients, trust is the result. In fact, patients who receive the gift of compassionate care are more committed to their treatment regimens, express greater satisfaction with their medical teams, and perhaps most important, enjoy noticeably improved health outcomes. Unfortunately, we are not doing so well at delivering compassionate care in our American healthcare system. The number of patients who experience compassionate care is in fact decreasing, despite the ample benefits of its benefits. A recent survey revealed that only 53% of patients in the United States feel that our healthcare system provides compassionate care. So what are the barriers in our clinics and hospitals to delivery of compassionate-centered care? First, many patients are allotted only 15 to 20 minutes for a routine clinic visit. As a result, healthcare providers have only very limited time to obtain all the information they need to evaluate medical problems, develop an effective treatment plan, to connect emotionally with their patients, to listen to their concerns and answer questions, and to establish the trust necessary to make shared decision-making possible. And of course, this is hardly enough time to discuss end-of-life plans with patients whose disease has progressed to a terminal stage. Another barrier is the fact that many physicians are much more comfortable discussing the biological aspects of a patient's disease than they are addressing the psychosocial ones. They are more familiar in explaining the physical nature of an illness or ordering a battery of tests or championing the benefits of technologically based therapies than speaking directly about the way that a disease may compromise a patient's quality of life or necessitate end-of-life decisions. A third barrier stems from the new demands of the electronic medical record, computers and digital medicine. Although computerized records have many virtues, there are some drawbacks. Healthcare providers must now enter a profusion of data into computers during patient visits. Some of you have no doubt experienced the distraction caused by this phenomenon. Your doctor or nurse spends a good time during the visit looking at a computer screen with hands on the keyboard. entering data and updating information. This is troubling, spending so much time in the computer and not the patient, because it's not conducive to the kind of bonding between physician and patient that engenders long-term trust and confidence. I know from my own clinical experience that patients do sense when a physician is present in the moment, attentive, caring, and unhurried. It is very difficult, however, to achieve this kind of compassionate interaction when one has to compete with a computer. And finally, our modern medical system is one in which hospitalized patients are increasingly cared for by clinicians with whom they have no previous relationship. Instead, patients are seen by whichever physicians are assigned to the ward. At the time they're hospitalized. And the personnel on that medical team may change from day to day or shift to shift. As a result, each new doctor who arrives on the ward spends more time in front of a computer screen familiarizing him or herself with the patient's condition. Consequently, the doctor will spend less time at the bedside and connecting with the patient, listening to questions and concerns, showing empathy for the patient's distress, and adjusting treatment recommendation based on the patient's own priorities. Again, such conditions make the practice of compassionate medical care quite challenging. Your Holiness, I would like to end with a quote from your little book of compassion, in which you state, "When we go to a hospital, irrespective of the doctor's quality, if the doctor shows genuine feeling and deep concern for us, or if he or she smiles, then we feel okay. But if the doctor shows little human affection, even though he or she may be a very great expert, we may feel unsure and nervous. This is human nature." Your Holiness, would you like to comment further on the importance of compassion and compassionate care in medicine?
I think that I already mentioned.
Covered long.
Already covered. I think your research is already chance of high level.
It's only saying that listening to you, the way in which you are already thinking about these problems is remarkable.
And all the
Panelists.
Panelists. I think yet you. So really, I think some kind of unanimous sort of view, the compassionate attitude is something very, very important. Now, I think we should carry more research work how to introduce, you see, training of that or awareness of importance of that in I think every field, even in economy field. I think more compassionate sort of attitude. Then I think those the big, the owner of big industry. I think the more compassionate boss, their relations with the employees are becoming much more healthier. And then their work really, because of the sincerely dedicated. If the relation between boss and the employer and employee, something only you see thinking about salary, no human sort of relations or human feeling. It's difficult. So every field, so particularly in medical education field and also the health field, I think the extremely important sort of role, compassion, affection, human. So now, I really feel, and I think the specialists, those people, from time to time, carry some seminar. You already sort of realize this is certain sort of problems. Now, how to
Address them.
How to address these problems? And we need this not only United States but other places also. And then some is a worst case. Even you see doctor in hospital, some healthy bodies, organs removed and selling. Really terrible, such sort of stories. I think a few years ago I met some doctor who have some sort of actually research work in this field at some country and also including China. This is selling organs. So taking from one healthy body a different name, remove and sell. So, and furthermore, I think on this planet, we, humanity, really, neglecting about this topmost inner value, topmost important inner value. As a result, a lot of unnecessary problems there. That's very serious of concern. So we have to think or concern the experienced people. I think should carry some research now how to
Bring it.
the gap of the soyaji.
That is. How to address the gaps that you see in the current system and how to incorporate and bring compassion into the system.
I think particularly like the United States, you have complete freedom. So individual, or the creativity or initiative. You can do. Now only thing is, because of that, more people discuss and will find certain new ideas. Then some hospital,
Adopt it.
adopt as an experiment project,
Like a pilot.
Pilot project. Then see some positive result. Then share more hospitals or state to state, different sort of places. Then I think other countries will follow. Sometimes the people I notice is a complaint in America, because of the hegemony,
Hegemony, dominance.
hegemony. But meantime, people, loves to copy American. Isn't it? So therefore, I think this country, I think the greatest democratic country, and a lot of because of innovations usually happen in technology field, these things. Now, I think inner value is concerned, you must also develop. This is certain new ideas, this is news, because of the new way to face this challenge. I think here you already expressing certain sort of concern. Then I think in some other underdeveloped country or developing country, I think much bigger problem. These things. Right.
No.
Much bigger. So I really very much impressed all your
Work.
the expression on the basis of your own expertise.
No?
Oh, really wonderful. Now,
Thank you. This is actually perfect timing because Dr. Garant runs a Center for Global Health, and he's been passionate about the, I heard him say one time about how we can get physicians to care for people they've never met. So I'd like to have him talk. He delivered a paper called A Declaration of Interdependence. So Dr. Grant, could you tell us a little bit about that?
One point you mentioned, you see, relation between doctors or patient or nurses is so important. So you see, changing that also is quite quite important thing. I was told, you see, the orphans, children, there is a person who look after them. You see, after a few months or a few weeks, it's change. It's very, very harmful. So you see, children's relation with person who taking care, once they become closer relations, close
Bond.
bond.
Bond is created,
That very important. So unless there's something highly necessary, the new person should take or change that person.
Take over now.
I think similar. And you see, in hospital, you see patient, the doctor who sort of look after his patient as much as sort of say
Possible.
longer period. So then, once you develop trust, truly feel something close friend. If that change, within a few 1 week, change new person, as you mentioned, I think that's also is difficult, right?
No.
Just each patient, one doctor, that's also difficult. But I don't know.
It's a balance. No.
어디지 간다데 MG 내가 땅에디 거기다 윤진지다고 뚝뚝 대통 말때 간다 갑작스럽지. 그래서 망쳐나 independence.
His Holiness is saying that of course, although it's a question of balance, because we cannot expect every patient to have only one doctor that he or she can relate to. But as much as possible, if the system can be structured so that patients are able to make a bond, create a bond with their caregivers, that makes a big difference.
Thank you so much, Your Holiness, David. Certainly, Your Holiness has written extensively throughout many of your writings about interdependence. And just now, you've, with George Beller, Dr. Beller, and all of us, have addressed the importance of compassion and caring in having a full and healthy life. What I would like to ask about now is the importance of compassion and caring for a full and healthy society or civilization. David, the rest of that title, A Declaration of Interdependence, was the survival value of caring for others. I was talking about global health and the ways that early childhood infections can have a profound impact, robbing them of their normal growth, but IQ and cognitive development, intellectual capacity. And so I was, a few years ago, asked to testify in Congress about why any of the hard-earned U.S. taxpayers' dollars should be spent for the improvement of health of children in, let's say, Ethiopia or anywhere else around the world where there are terrible needs. And so I mentioned 3 E's. The first, as an infectious diseases physician, I suggested emerging infections that might threaten all of us, at least microbiologically, and in many other ways. We are in it together. We are one.
emerging infections. 이 담보들이죠.
My second E was the exploding population without good health. Our Malthusian notion that disease and poverty are what control population overgrowth is dangerously backwards. It is only good health that has ever controlled population overgrowth in our own history and around the world. But I have to admit, the third E may be the really important one, and that is the erosion of who we are as human beings if we turn our backs. And so, Your Holiness, I return to ask what I think is an increasingly urgent question in our dangerously divisive world today, and that is, how can we be motivated, better motivated, to think and act beyond just ourselves, to actually enhance rather than threaten those around us? We seek your wisdom.
That's the key factor. Actually, my number one commitment is promoting the human compassion or affection. Many problems, ultimately, lack of that. So, extreme self-centered attitude. Then, a lot of other injustice in every field, and corruptions, and bullying, exploitation. All these things happen. And eventually, environment also suffer. So whole world, some sort of unnecessary problems facing, ultimately because of I think there are many sort of, millions of different species of
animals
or life, different there. They also have a lot of emotions, but because of lack of intelligence, they are destructive emotion, destructive action, very limited. Now we human beings, this wonderful human brain, itself wonderful, but this wonderful brain combined with destructive emotion, then destruction also immense. So therefore, it is really now time come. We have to take seriously look the root cause of all these problems. That I believe, warm-heartedness, and sense of concern of others' well-being there. Then, no basis cheating, no basis bully, no basis exploitation, because you respect their right. You really voluntarily take sort of serious concern about their well-being. And through that way, there is no basis of violence. Some disagreement there, some disagreement happen, then through talk. within the spirit of brotherhood, sisterhood. And then through that way, I think we'll become really happy human family. So now we have to think. Now here, the various different religions, as I think I mentioned, all religious traditions carry the message of love and forgiveness, these things. But effect limited. Even among those religious-minded people, corruption is there, injustice, cheating, and among the religious people, hypocrisy, pretensions. Sometimes, if we use wrong way, religion also teach us how to act hypocrisy or pretension, or you supposed very holy. And telling nice things, but behind all sorts of negative things. So that actually not only cheating human being, but also cheating God. Isn't it? All this, we are lacking the real sort of the principles. No. Honest, remain honest, truthful. Honest, truthful, how can develop a sense of concern of others' well-being? Once that is there, then there's no object to tell lie, exploit like that. So therefore, I think key factor is we have to develop sense of concern of others' well-being. That also is not through, that is a religious practice. If you practice that, you will go heaven. Or for Buddhist, you will reach Buddhahood. Not that way. But day by day, day-to-day life, very much related with these things. As we already sort of mentioned, or discussed, or touched. Home-heartedness here. No room, jealousy, suspicion. Through that way, no room, frustration, stress. No room, anger, hatred. So that really creates inner peace, self-confidence, inner strength. Result, your mind become calm. And health viewpoint also, and very good for our health. And a healthy family also, you see, because of the healthy family also depend on the home-heartedness. And a healthy society or community also related to that. Then economist, or scientist, or educationists, or doctors, or politicians. I think every sort of the field of human activities. With that feeling there, then every human activities become positive, constructive. Once that is lacking, then even religion itself also sometimes creates more problem, isn't it? So I think so therefore, now my sort of attempt is without touching religion, use our common sense and common experience, as we already now discussed, our common sort of experience, common sort of sense, and then scientific finding. So all these of your sort of the presentation, not based on faith, but based on your own experiences. So that's because of the scientific sort of
scientific finding.
Scientific finding. Then some scientists actually say constant fear, constant anger is actually eating our immune system. Calm mind is very, very helpful to sustain a healthy body like that. So that I usually call
secular way of
secular way of approach about the inner value, secular way, not touching religion. And anyone who have sort of interest about religion, that's good. All religion, you see,
teach this.
actually, also they strengthening these basic human value. So those people who have not much interest about religion, then we should find ways, means to make the awareness of the importance of warm-heartedness, like that. That I think the key factor is education. I feel education. So education sort of system remain like this, and the whole society only think about oneself. Top most important is oneself. And then our sort of talks just complain. The root cause remain there. Not only our generation, I think the whole 21st century will go complain. So now this is the right time. We have to tackle the root cause. This is my feeling, isn't it? That's my view. Maybe.
I believe we were at the end of our time. I don't know if there's any final words you'd like to say. I don't know if we can. That was a great place to. There was a great comment there, but
Correct.
Your Holiness, if you have anything else you'd like to say.
Nothing. Perhaps from audience, some questions maybe. Okay.
Well, I actually have a question that came from a medical student. Would that be? Could I ask you that question?
Yes.
Because I think it's
I see. Already. But one question, yes.
one more question. Actually, I'd like to ask you a different question, if that's okay, not the medical students. It's only one, so maybe it's my turn now.
Oh, yes.
Okay. My question is, after a person suffers a deep loss, such as the loss of a spouse, the death of a spouse, or the death of a child, is there a practice, or do you have advice that helps the grief to be acknowledged and understood and allows a balanced and happy life to return?
I usually say, telling people, according to my own experience, I often is mentioning, when my tutor, who gave me ordination, full ordination, really very, very sort of dear in my heart. So when he passed away, I really felt till then some kind of solid rock where I can
lean on.
Lean on. Now they're no longer. So some kind of stay, the protectless way.
With a sense of without being any protector.
Oh. But then I use my intelligence. Now, no use that kind of sort of worry. Already happened. So too much worry, never bring back my tutor. So what to do is my tutor's sort of wish and his sort of advice to me. Now time come, I must fulfill what he wish me be.
네.
Be.
네.
So I think those people, whose dear friend or parent or all of that,
Spouse.
the couple, should think that person very dear to me, I also very dear. So then I should now fulfill their wish. If those people who have some sort of belief, their existence, because of that, continuously their existence there,
네.
then some way, if they know, say your position, your situation, in spite of that tragedy, you carry your work very sincerely and with sort of with the feeling, I now fulfill all my dear's wish. Then they really feel very happy. On the other hand, too much worry and demoralized, almost a state of helplessness sort of state. Then I think they feel, I think, very sad. Not only their own sort of end of life, but also is very much concerned about their dear other person. So thinking these lines, then the tragedy, instead of causing because of that weak way,
making you weak.
Instead of that, you see, take more new willpower and optimistic sort of determination. That I think better. Usually I state that way. To some people, it seems that approach work. For some people, not work. Then what to do? Thank you.
보고 소리야.
그래서 내가 메디컬 좀 할래.
러레. 코란타는 부부 멤버래셔.
맞아요. 맞아요. 손으로 들어. Respected brothers, sisters, and audience brothers, sisters. Indeed, I'm very happy and great honor. At the same time, I think real topic about medical care. So I'm not a physician. I do not know any medical things. Only thing, take medicine. Then I think I want to mention to you something. Many years ago, one time in England, Albert
Hall.
Albert Hall. You see that?
Royal Albert Hall. Yeah.
Royal
Albert Hall.
This is my some lecture talk. Then at the beginning I mentioned among the audience some may have sort of the feeling of curiosity and simply, you see, came to listen to my talk. That's okay, no problem. And then some people may have sort of feeling or view Dalai Lama have miracle power. That's nonsense. Then some people may feel Dalai Lama have healing power. Then I told, so So that is totally also a mistake. Firstly, I might
mean by mindfulness? And then could you talk about why it's important that we encourage mindfulness in our children in a society that works against it?
Thank you. I would like to personally express my appreciation first for the visit of Your Holiness and for the very positive messages that you bring us. Buddhism encourages us to be aware of our behavior and its sources, to be present in the moment, and to control our cravings and desires. It teaches us that these practices can bring true happiness. The Mindfulness Center here at UVA uses the term mindfulness to encompass this beautiful philosophy and defines the term as non-judgmental, present moment awareness. However, it is difficult to practice this philosophy in our Western society, which seems to embrace its very opposite. All our time must be killed, all our needs must be filled. As a pediatrician, I am particularly concerned that our children will grow up in a world without silence, without peace. I am concerned that our generation of adults is insufficiently prepared to teach or model an alternative. How should we begin with ourselves and our children to bring a little more peace and awareness to our lives?
So you're asking His Holiness the question?
Yes.
Yeah.
experts, very important. That meantime, we are living sort of sentient being. We have the feeling. We very much appreciate human affection. So is it the medical treatment with affectionate sort of attitude, affectionate feeling or motivation, then that medical treatment becomes more effective. That I believe. Sometimes in Tibet, this is my friend, when I was very young, they say, oh, such doctor, physician, their knowledge is concerned, expert, but their medicine not very effective because their heart not very good.
Not very compassionate. No?
Not very compassionate. Then such a doctor, their sort of knowledge or qualification may not be so high, but a very warm-hearted sort of person. So therefore, their medicine much more effective. So that also shows the professional sort of knowledge and sincere motivation, compassionate motivation combined together. I think they did because of the strategy. You see, you mentioned that although you trained, but after you met that native girl,
The girl.
so I think that's very important. So and I think with that kind of motivation, that kind of expression, not only they receive some positive sort of feeling towards patient, but doctor himself or herself, then your work.
This morning we're going to have a panel discussion on healthcare, in which I will ask our physicians and the dean of the nursing school questions, and then have some comments and insights from His Holiness. But first, allow me to introduce the members of our panel. Seated to my left is Dr. Dick Garant. He is the founding director of the University of Virginia Center for Global Health, a recipient of the Walter Reed Medal and the Thomas Jefferson Award, and a member of the Institute of Medicine of the National Academy of Sciences. Next to him is Dr. Leslie Blackhall. Leslie is an associate professor of internal medicine at the University of Virginia and director of the Palliative Care Center. She is also an associate professor in South Asian Studies and Tibetan Studies. Seated to His Holiness' left is Dr. Jim Nataro, the pediatrician-in-chief at the University of Virginia's Children's Hospital. Dr. Nataro is a voice for children's health, not just at the university, but for children throughout our community. Next to him is Dean Dory Fontaine. She is a dean and professor at the University of Virginia Nursing School. She is a strong advocate for interprofessional education and has started a compassionate care and empathic leadership initiative at the university. And finally, Your Holiness, this is Dr. George Beller. Dr. Beller is professor of cardiology at the University of Virginia. He was chairman of cardiology for 28 years and started the first cardiac rehabilitation program in Virginia. And of course, joining us today, making this a very special day, is the spiritual leader of Tibet, the recipient of the Nobel Peace Prize, His Holiness the 14th Dalai Lama. So I would like to begin today by asking a question of Dr. Nataro. Jim, could you offer a brief definition of what...
Myself, very, very skeptical about this so-called healing power. And if there are really sort of a person who has a real sort of healing power, then I would like to call that person and show it's my skin disease. Then next day, I received some ointment for this. That's a real blessing. That's a real healer. So that means medicine is very, very essential, very important. Perhaps I may add something. I think we all have the same experience when we sort of medical checkup or some treatment in hospital. The doctors and nurses who are taking care of you, showing more human feeling, genuine love, or sort of genuine sense of concern for the patient's sort of health. Then you feel more confidence, or they're really taking care of me. Sometimes some doctors, nurses, without smile, and carrying their work almost like their duty, and treat it like you as a mission. Then sometimes you feel a little anxiety.
Anxious.
Such people, you see, even may carry some experiment on my body, like that kind of feeling sometimes happen. So therefore, the medical sort of treatment itself, of course, very important, qualified one.